The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Stay tuned today for Aging Horizons. We'll be speaking with Renee Labrie-Shanks all about the Senior Medicare Patrol and all about how you can prevent fraud in Montana happening all around your Medicare dollars, what to look out for, what scams are currently happening, and where can we go to for resources in our community. You're not going to want to miss all of this important information about preventing Medicare fraud, so stay tuned to today's Aging Horizons.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare Preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
If the Aging Network in Montana was a restaurant, the sign out front would say, over 50 million meals served over the last 30 years. Since adequate nutrition is critical to health and quality of life, nutrition services are an important factor in keeping older Montanans healthy, independent, and living in their community and home. To find out more about senior nutrition programs in your area, call 1-800-551-3191.
Final call from Flight 566.
Hello, gentlemen. May I see your Montana Real IDs?
IDs? Why, I'm Captain Meriwether Lewis.
And I'm Captain William Clark.
Hang on, I see more than one William Clark.
It's the real me, I promise.
Discover more at mtrealid.gov. Available now.
Montana Real ID. It's the real me.
And me.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host for today, Katie Lovell, and today we're speaking with Renee Labrie-Shanks all about Senior Medicare Patrol. Renee, thank you for joining us.
Thanks for having me.
I know we're going to talk a little bit about abuse of Medicare dollars and fraud, but first, can you tell me all about the Senior Medicare Patrol?
Certainly. It stands for, well, SMP is what we call it. At Montana SMP, it stands for Senior Medicare Patrol, and we empower seniors to prevent healthcare waste, fraud, and abuse. It's that in a nutshell, but what that means is we teach people and educate people on what to look out for and stay abreast of the latest scams.
And are there people in every community, or is it a central location that you all work from?
Yes, we are a statewide program. We partner with every area agency on aging across Montana. It's a national program as well, so if folks are in other states or have loved ones in other states, they can contact an SMP there.
Okay. And how does the SMP go about doing your work, going about educating the public?
That's a great question. We do it many ways, and it's different in each community as well, based on the needs of those communities. We have volunteers that we train, and they help give presentations. Staff are giving presentations. We are available on location if folks want to bring in their Medicare statements, healthcare bills, so we can look at them and answer questions for them. And we also hand out material at events, and we process out scam alerts through the community network.
So it's both like an individual advocacy and then as a community-wide advocacy as well. So you're doing both types of education.
Yes, we're trying to reach people any which way we can.
That's wonderful. What does the Senior Medicare Patrol empower seniors to do to prevent fraud? So what are actions that seniors can take themselves?
Well, we want people to know and understand that they are the first line of defense. They are the ones that are actually, they have the power to stop it. So Medicare processes about 4.5 million claims a day. They don't know what doctor you saw. They don't know what services you received, and they certainly don't know what supplies you ordered or didn't order. So the person receiving their Medicare summary notice, they need to open them and they need to read them. Or if you're in a caregiver situation, read them for somebody else. And just look over the dates, the providers, the services, and make sure there's no questions.
Absolutely. So why would somebody reach out to call you? What types of things might somebody notice on their bill, on their statement? Why would they be reaching out?
That's a great question. First of all, we want them to reach us instead of calling 1-800-Medicare if they can, because we are a face. We're somebody they can come in and see. It's hard sometimes to explain things over the phone, and maybe we can just explain things better once we see what's going on. But we want them to look for, say, a double billing or something that they don't recognize, like maybe a date they don't remember getting a service, or a provider they've never seen, and we're going to get into it a little later on, but a supply they didn't order, or something that they have no recollection, or they didn't order and they're getting charged for, or Medicare is being billed for.
So we talked about abuse, fraud, and waste. What is an example of waste?
Waste are mistakes, most likely. They're the errors that happen, and a lot of human errors. We're dealing with codes. They could be miscoded, transposed numbers, human error, that kind of thing. It could be a simple using the wrong code. For instance, maybe billing for a new to Medicare visit, which you get in your first year on Medicare, instead of a wellness visit, which happens every year thereafter. And that'll get denied by Medicare because they know when you are eligible to get those services again.
Sure. So if you've received a denial notice and you're not sure why, that could be an example of something that they could come to you about.
Yes.
Wonderful. Okay. So what's an example of fraud or abuse?
That's those two. We don't need people to know definitely which the one it is or not, but the intent has to be there for it to be fraud. Abuse is taking advantage of a situation, basically. So say a provider upcodes. Say you went in for a service and then you see a bill and it just seems too high. That may be accurate. Healthcare is a billion-dollar industry. However, it might be that you're being billed for more than what you actually received. And then fraud would be outright, you are getting billed for something you did not order or did not receive.
And in Montana, do we see a lot of this? Is this happening often? Is this something that people are coming to you on a daily, weekly, monthly, annual basis?
Yeah, well, it depends. Right now, we're in the midst of a huge fraud event in Montana and nationwide involving durable medical equipment.
Okay.
And also there's another scam going around involving genetic testing. Previously to this, we are generally a low fraud state, and I always like to say, great, let's keep it that way, and we'll keep educating people on what to look out for. So we do really want to tell people everything about this durable medical equipment and diabetic supply scams that they're hitting Montana particularly hard as well.
Sure. In Montana, do we see more of the fraud and abuse cases or more of the waste sort of cases, or is it kind of even?
Well, what we see with Montana SMP, what comes through our doors is more of the waste.
Sure.
It's more of the, maybe we're just educating somebody on their Medicare benefits that this wasn't a covered service and here's why, or your insurance didn't cover it and this is why. Those kind of things that we see more often than not.
That's a lot of really important education. Knowing what your healthcare covers is so important. So it's really great that people have a place to turn to. And to remind me again how people access the SMP folks.
Sure. We are co-located in most area agencies on aging with the SHIP program, which is a state health assistance program. And those can all be reached through the 1-800-551-3191 to get your local SMP and your local SHIP. And we're always say two sides of the same coin. SHIP is enrollment and benefits. You want to understand what your benefits are so you can utilize them the best. And then SMP, the other side of that, is the waste, fraud, and abuse.
Wonderful. Thank you so much, Renee. When we get back, I want to talk a little bit about that fraud that you mentioned, that durable medical equipment.
Yes.
So that's a huge one happening nationwide. So make sure you stay tuned because you're not going to want to miss that discussion on Medicare fraud around durable medical equipment.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
The face of the American workforce is changing. People are healthier, living longer, and living better. Baby boomers are a valuable resource for the workplace of today and tomorrow. They're still active and eager to help. Experience, dedication, wisdom, these are just some of the significant assets older workers bring to the job. Age is an asset, experience a benefit.
I'm Attorney General Tim Fox. Nowadays, all of you have to worry about cybersecurity. Something as simple as visiting pirate websites can put your computer at risk. Hackers use pirate websites to infect your computer and steal your ID and financial information, or even take over your computer camera without you knowing it. Don't let hackers into your house. Be careful with the websites you visit and warn your kids on how to stay safe online. To learn more, visit my website.
Welcome back to Aging Horizons. Today we're speaking with Renee Labrie-Shanks all about the Senior Medicare Patrol and preventing fraud in Montana and across the nation. So Renee, let's talk about some of the scams that are happening here in Montana and nationwide right now. So I know a new Medicare card just came out, so I'm assuming the scams came out right about the same time. So what's going on with that in Montana?
Well, we were worried that people were going to be taken advantage of because of the new cards and confusion around that.
Sure.
People saying we need to laminate your card and this is what it'll cost. We need to mail you a new card. This is what it'll cost. I feel like we've really headed that off at the pass, and I haven't heard of a lot get through in Montana regarding that. But we do want to impress upon people, everybody should have their new Medicare card, and if they don't, call Medicare, Social Security office. They need to get the correct address probably on file is what happened. Sure. But everybody should have that. The old one will expire December 31st of this year. So right now they can use either or, but that's going to end this year. And then we want to also ensure people understand, even though it is no longer attached to their identity, it's a unique identifier with numbers and letters now, if it gets into the wrong hands, they can still bill medical or Medicare like a credit card. So they need to protect it just like they did before.
You still need to keep that number really safe and secure.
Yes.
Okay. So how does the average beneficiary go about preventing fraud and going about reporting it?
That is a multifaceted question, but the simplest answer is, again, read that Medicare summary notice.
Okay.
I want to ask you a question. How much do you think we spend on the Environmental Protection Agency as a federal government?
I have no idea, but I'm going to guess like $100 million, somewhere in there.
We spend $3 billion.
Oh my goodness. I was
Homeland Security is about $42.2 billion.
Okay.
Guess how much we lose each year to Medicare fraud?
I'm hoping it's not more than $1 billion.
It's $60 billion.
Oh my God.
We lose $60 billion a year just to Medicare fraud. So that is what, when people worry about Medicare being solvent, if we can stop the fraud, we can make it solvent.
Absolutely.
And when people say, oh, we recovered $1.9 million, we don't recover $1.9 million because we've spent money investigating it, we've spent money prosecuting it, and the criminal probably doesn't have all the money they stole sitting in a bank ready to hand it over.
Right.
So we need people to understand they can stop that $60 billion loss every year by just opening up the statements and stopping it when it's $100. They'll know if they saw a provider or not. They'll know what service. Medicare doesn't know that stuff.
Right. So it's really upon the beneficiaries to really take that first step, to be that first line of defense.
It really is. I think people just assume everything's billed electronically. Medicare knows the doctors will do it. Everything's fine. Unfortunately, if their information gets out there and they're not paying attention, it can be used against Medicare. And if people just pay attention, just open their statements. There was a case in Colorado Springs where a daughter visiting her mom opened a pile of unopened Medicare statements.
Sure.
And she uncovered a $1.2 million fraud instance going on right under their noses. And it was just opening it up and going, why are you getting psychotherapy?
Yeah.
So it's simple. It really is.
That's a great thing that we can all do. You know, it's an action that isn't out of our reach, isn't too hard for the average person to be able to do. So just reading your own statements,
Right.
so important. So let's talk a little bit about those durable medical equipment. I've seen the stories on the news. I've heard that this is a new big bad deal going on. So tell me a little bit about it.
Yeah, there's so many parts and moving pieces to it that connect, and part of the reason this is happening, I think, right now is last year robocalls were no longer, they lifted the rule or the ban on robocallers and auto dialers. So we've seen a 60% increase in just the amount of calls that are getting through to mobile phones.
Sure.
And once folks get you on the line, that's when they can take advantage of people if they get you at the right moment. And so what's happening are we're getting calls coming through from suppliers, unscrupulous providers across the nation, not in Montana. They're calling from elsewhere, and they're saying Medicare records show you're eligible for. And this is something that you can get, and it's braces, orthotics, wrist braces, lumbar, all of those. And once they get you, and this is whether you say yes or not, because what they do is they got enough info on you, they've talked to you, they fax your provider. Everybody's had a bad back, everybody's hurt their hand. So these are things that doctors go, oh, okay, they want a back brace, they can have a back brace. But what we're seeing even more now is providers that nobody's heard of, that nobody's seen, nobody's talked to, that they're being the ones that order these supplies. So that'll show up on an MSN, and people will start getting them in the mail. There was one woman in Billings that received 20 different items from 7 suppliers in a 2-month period. She lives in an assisted living, and she has some mild dementia. She did not order any of the supplies, let alone from one company. So this is a type of thing, if people receive unordered supplies in the mail or get the calls and then they've got the information that they can send on to us, we want to hear about it.
Sure.
We need them to refuse the items or send them back and give our offices a call, because we want to get this reported to the Office of Inspector General as soon as possible.
And what kind of supplies are they sending?
They're sending all sorts of orthotics. So the big one is the back brace. It starts out maybe a left wrist, a right wrist, a left lumbar sacral orthotic. I've seen all sorts of them. And then, you know, they come in the mail and they're billing Medicare for thousands of dollars. We have over, 200,000 beneficiaries in Montana, and I've seen some get away with approving and paying over $2,000, $3,000 by the time everything's said and done. And if that happens to everybody, that's a lot of money going out just on this one type of fraud. And there are multiple companies. I've seen probably 5 different doctors rotating amongst all of these supply companies so far that people haven't seen. They're not local providers. And then I've also seen probably a handful of companies that are hitting multiple beneficiaries. But a lot of these companies, they're using different names. They have addresses that are different suites in the same building. So there's something that people would know. They would know that I don't need all of this stuff. Medicare might provide some of it. They might cover the first ones, but then they'll see denials come through with the next ones because they've already received that item.
Sure, absolutely. Renee, thank you so much for that information. And we come back, we're going to be talking about what you can do for these scams, how you can read your statements, and who you should be referring to. So stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. Today we're speaking with Renee Labrie-Shanks all about Senior Medicare Patrol and how you can prevent fraud with Medicare as a partner. So Renee, we just talked about the durable medical equipment. Are there any other scams that Montanans should really be aware of right now?
Yeah, right now we're really keeping an eye out on genetic testing scams.
Okay.
We've heard from people who respond to Facebook ads, unsolicited flyers, but also workshops or events going on at senior centers or housing facilities. We're trying to really get a lid on that as well. We want people to know that yes, Medicare might cover genetic testing for cancer screening or something.
Sure.
It has to be ordered by your doctor. It has to be under certain circumstances medically necessary. They can't just go in and get a cheek swab and send it in. It's just not going to work that way, and Medicare is not going to cover that. So that's something they need to be aware of before they fall victim of that, because not only will their Medicare information be out there, but so will their genetic information.
And then they end up paying for those services out of pocket, I assume, because Medicare doesn't cover it.
Yeah, Medicare is not going to cover those.
That's bad all around.
Mm-hmm.
Yeah.
And that's when people call us, is when Medicare denies it, which brings us back to that durable medical equipment or even the diabetic supplies. If you're ordering from these companies you've never heard of, you've never seen, they're not going to provide a device and then make sure it fits you properly, follow up with you. They just want to get the supply to you so they can bill Medicare as fast as possible.
Sure.
You may not see a bill for the remainder of it because they know that's when you're really going to question it. So that's what we really want people to look at, those statements. If they do get supplies, give us a call. We want them to send those back and get Medicare the money back.
Sure, absolutely. So when we talk about reading our statements, I've seen some of my own EOBs at home, and sometimes I have no idea. Did I actually get that? Aren't these statements kind of confusing for people?
We hope not as much. They've redesigned them several years ago. Every office on aging can help people understand their Medicare summary notice, and once they understand it, it doesn't change. So it should be easy enough after that. And Medicare Advantage, EOBs, or explanation of benefits, the same thing. They usually have a understanding, like how to understand your claim page, and then all of theirs, if they're with Humana, if they're with Blue Cross, that company's EOB won't be changing. So once they get a handle on how to read their statement, which they again can go through the SHIP or the SMP offices for help with that, it should be easy. But it has the dates, it has the suppliers, and it has a description of what happened.
So what about people who are receiving a lot of services in a short period of time? Either they've been hospitalized or they had an acute illness or an accident. How are the resources to help people that are doing a lot of visiting of medical providers in a short time?
Yes, we do ask people if they could track those with a calendar or a healthcare journal, something like that. And then we also have these envelopes where they run with a Medicare summary notice, and people can use them to track everything that's coming in, and they hold everything in one place as well. Because the best way to find out, did I pay for that? Did I not? Was it covered? What's going on? Is to just line it all out, and you can visually see what's going on.
See what you had and when.
Yeah, and we have tools that can help people.
That's super important, super, super important. What about, is there anything you'd like people to understand about the scams that we haven't talked about yet?
Well, in general, I can't even say it enough because I know people aren't all opening up their statements. But to protect Medicare and to protect your number, Medicare is not going to call you. The government is not going to call you. They might mail you a letter, and if you get a letter that you don't understand, maybe it's from the U.S. Treasury Department or something, give us a call and we can talk you through all of that. But just know, Medicare is not going to call you. They're not going to charge you for a card, and they're certainly not going to instigate ordering supplies for you. Your doctor is the person who should be ordering supplies. So if people do need a back brace, by all means, get a back brace, but go through the right channels for that.
It's that way it's fitted to you. It's something appropriate for your needs. That
yes,
way. Yeah.
And then somebody's not going to turn around and send you 5 more items that you don't need.
Absolutely. Are there simple tips, simple tricks that we can think about when we are talking about our statements of thinking about Medicare fraud?
Sure. I like to always say protect, detect, report. So protect is don't give out your number in the first place. And we know these numbers were changed so people can cancel them if they need to, if it's been compromised. But if you can imagine, if everybody calls Medicare and says, I need a new card because it's been compromised, that alone will cost just as much as the fraud in the end. So we want people to protect it from going into the wrong hands, and to detect by reading their summary notices or their Medicare Advantage EOBs, and then finally to report anything that they don't understand to our offices. It could be educational, where we make them understand why it or wasn't covered, or it could be, like right now, we are referring several cases to the Office of Inspector General regarding this DME fraud.
Wonderful. Report, detect, detect, report. Okay. And how? Tell me again how people access their local SMP volunteers.
Yeah, the 1-800-551-3191 will connect them to their closest office on aging. And each office on aging, if there is a DME fraud case going on, will be calling me as well.
Wonderful. Renee, thank you so much for joining us today. I learned so much about Medicare fraud, and I will be making sure that everyone I know is opening their statements, because that's so important. So thank you, and thank you for staying tuned to today's Aging Horizon about Senior Medicare Patrol and preventing Medicare fraud.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.